The cost of dental implants. I mean, not everybody, but a lot of people say this is an expensive procedure. So what's the best way to minimize your expense when it comes to dental implant dentistry? What advice could you give us?
When you're having dental implant dentistry, especially if you're considering having something like a teeth in a day procedure where we're replacing all of the teeth with dental implants in a single day, by working with an office such as ours where everything is contained under one roof, where you have the surgeons in one roof, you have the restorative dentist, the lab, everything together, it allows us to really minimize the cost, because the traditional model is you have a dentist and they are going to work with another specialist, and they're going to work with an imaging center and an outside laboratory. And when you have all of these different people working together, all of the costs start going up.
Because you got to pay the lab.
You have to pay
the oral surgeon, the periodontist, and you got to pay the general dentist,
right?
The imaging center. But if you go to a place that it's all right there, you have the specialist.
When everything is all together,
makes sense.
That is our common goal, is treating the patient for this procedure, and we don't have to increase those costs by having a bunch of other outside parties involved. Also, because this is the bulk of what we do, we are able to get certain supplies and equipment, such as dental implants, at lower costs than other offices, because we do a high volume of these. Whereas other offices, if they just do a handful of implants a year, they're not going to get the implants for the price we do, and they pass those costs along to the patient. And also the experience of having it done properly. So if somebody's having to do older style procedures with bone grafts and a variety of other procedures that may not necessarily have to be done, that's going to start driving up your cost.
I know your cost for a full mouth of teeth that don't come in and out, and you're less than the big guys. Like substantially, like major cost savings by doing it there. Somebody said, if I had my own lab like Dr. Holtzclaw, of course I could do that too. Is that your secret sauce? The fact that, you save money on your lab bill because you have your own lab.
Well,
is that one of the things?
One of the things is we have done thousands of these procedures, so we're very efficient at it.
Okay.
Whereas some people will take all day to do these procedures, we can do them much more quickly. Where it takes them a year to finish this procedure, we can finish it in 5 months. That saves time, it saves money. Also, by having this laboratory equipment, we can cut our costs down because, one, we can do everything ourselves. We can also offer materials that you can't get unless you have some of this equipment. If you're using an outside lab, you have no ability to get some of the materials that we use.
So if you had to go back, if you had to work like a regular dentist at most offices across the country, and you had to send all your stuff out, you'd have to charge more.
Of course.
Is that true?
Because the lab has to pay their
employees. And you got to bring in a guy to do the IV sedation. It's going to cost you more.
Exactly. And
interesting.
We have all of that taken care of by our personnel that's in-house, so we don't have many of the costs that the traditional dental technique has. We have everything together, and we pass those savings along to the consumer.
So with your experience, you've done thousands and thousands. You do everything right there. It would be hard to compete with you in San Antonio or Austin on price, because you're going to beat them on price, it seems like, just about every time.
In terms of price experience, I would honestly say the only reason that we don't work with certain patients is because they just haven't heard about us. There are certain offices in town that do offer very, very lowball prices, but many times you have to look at the fine print on those. Many times that doesn't include teeth coming out. Many times it doesn't include sedation. Many times it only includes 4 implants. If you need more, you're going to be paying per implant. When we do the procedures at our office, it's an all-inclusive fee.
Nice.
If we add additional implants, there's no additional fee. If we do any bone grafting procedures, which is rare, there's no additional fee. It's just one flat fee, and that covers everything. And that's where some people will get into trouble going to a lower cost office because, one, there are a lot of hidden fees. 2, typically those offices haven't done near as many procedures that we've done, and if you run into any problems, typically they're not fixing those problems for free. They're charging you to fix any of those problems, and by the time you start adding those costs up, you've paid significantly more, even though it was the cheapest place to go to.
So it's better to just get it done in one place.
Get it done in one place and get it done by experienced people that is
Good.
really, this is the focus of what we do.